With a growing senior population in Tennessee,
It's a big deal. It happens daily.
Medicaid and Medicare fraud continues to be a growing concern.
It can happen anywhere. It can happen at a pharmacy. It can happen at a home health agency. It can happen at a drug treatment center.
This kind of crime involves billing Medicaid or Medicare, both taxpayer-funded systems, for services patients didn't receive, billing for services outside the correct time frame, and in some cases, falsifying medical records.
In some situations, we're seeing where, outside groups are getting into and investing in a particular type of provider, a nursing home chain or a nursing home facility. And yeah, the focus could be on profit and not on patient care. So they're not providing, adequate services. They're providing the minimum amount of services, sometimes under-providing services, low-quality food, low-quality, staffing. It has a huge impact on the quality of care that our beneficiaries receive.
Spotting the red flags can be critical to curbing this kind of crime. Patients, their caregivers, or loved ones may notice line items on explanations of benefits, or EOBs, don't align with the care received.
Are they being told something is free or no cost, and then they look at their statement later and they see that thousands of dollars were billed?
Patients or their caregivers may also spot irregularities or something that seems a bit off when visiting care clinics. What may seem efficient may instead point to something criminal.
If they feel that the provider is not a licensed provider, so for example, if there are no vitals taken or no additional steps as far as checking to ensure that this is the proper diagnosis. If you come to a clinic and the lobby is packed full with a lot of patients and you see someone go into an exam room for maybe 1 minute, maybe 2 minutes max, and walk out, there's some things that you may want to keep your eyes open and close to as far as, did they actually see a nurse? Did they actually see a doctor? Did they see only a medical assistant? Did they receive a prescription from the doctor or someone from up front, from the front desk? Those are a couple things that they can look out for when they go to the clinic.
To further protect yourself, be sure to guard your personal information, including your member identification number. So, if you receive a sales call recommending a new medical device or treatment, be leery and assertive.
Don't be afraid to hang up. If they're being bullied on the phone and somebody's harassing them with a lot of questions, not giving them a chance to speak, and they obviously can hang up if they're suspicious that it's a fraudulent type call. They can call their doctor's office. Sometimes these callers will say, their doctor referred them. Maybe that's not true, or they're calling because Medicare wants you to have this particular product. That's not true.
If something seems suspicious, report it. If you're a Medicaid recipient, call the hotline on your member card or contact TBI's Medicaid Fraud Control Division online at tn.gov/TBI. If you receive Medicare, call 1-800-MEDICARE or Health and Human Services at 1-800-HHS-TIPS. Find more links and information online at SafeSeniorTN.com.
Every day there's a new challenge. 10 care providers are coming up with different schemes. What may be a scheme today may be different tomorrow, and I want to be sure that I am serving the citizens of Tennessee, especially for those who do not have a voice, for the elderly, for the vulnerable, and that's why I enjoy this work.